what advice would you have for anybody that might be considering surgery? Maybe they're not 100% sure on their decision yet.
Yeah, don't do it.
Chemical X. What's up, guys? Welcome back to the Chemical X podcast. It's your girl, Veronica.
And your other girl, Alessia.
And today we have a very special guest that we've been anticipating since the beginning of this podcast. Karl Schwarz, welcome.
Hi, thank you.
Thank you for creating us the noses that we have now to this day. That has got us this far. So
That's confidential.
it's not confidential on this podcast.
No,
News
nothing
here.
Yeah.
So you are, for anyone that doesn't know, a plastic surgeon in the Montreal Laval area. How long have you been doing surgeries?
So I've been in practice now for 15 years.
15, okay.
15 years that I moved back to Montreal, but I did my training in the US. So I did a 6-year residency in plastic surgery. So at that point, you're already starting to operate and learning the things.
Right.
So 6 years there in Washington, and then I moved back 15 years ago. So.
Interesting. And how come you didn't decide to stay in the US?
Well, part of it was a family decision. So
Okay.
I had my parents who were here, and my roots were here. And I'd been gone for 15 years. I'd lived in New York and Washington, and for sure Montreal was my favorite city. Great place to live, great place to raise a family. So I thought of the future and decided to come back. I was also offered a job at McGill doing a lot of breast reconstruction. So when I first started my career, it was heavy on the breast reconstruction for cancer patients. So it was one of the draws that brought me back.
Okay.
Yeah.
And what made you want to be a plastic surgeon?
So it was not like in the movies where there's like an epiphany and I saw a particular
You're like,
patient.
this is it.
You saw a girl with really nice tits and you were like, I want to create those.
That was not that. But it was a bit of a slow process. So when I was in college, for lack of like better option, I decided, okay, well, I'm going to do pre-med stuff. And my father was a plastic surgeon here in Montreal. So I just decided to go into pre-med. And then once I was in pre-med, I got into that track. And so I knew I was going to med school. I was gravitating towards surgery, but I didn't know what. And then once I got into medical school, you kind of get exposure to all the different specialties. So you'll do like 2 months in orthopedic surgery, 2 months in general surgery, urology, plastic surgery. And I thought I wanted to do orthopedic surgery for a couple of years. But then I kind of switched my mind because those big surgeries, like a lot like, not to put down orthopedic surgeons because they're very talented, but it's more like carpentry, you know?
Okay.
There's a lot of heavy tools and drilling and things, which I liked at the beginning.
Is feet.
No, orthopedics, bones, basically.
Bones.
Tendons and stuff, but essentially bones.
Okay. I don't know why I thought it was feet.
No, that's podiatry. That's podiatry. and they're not doctors, but anyway, that's
We're a level one here.
Yeah. But so then, like, I was exposed a little bit more to plastic surgery, and the more I saw it, the more I would like it, and it was like a slow process for me. The reconstructive part, like the artistic part, it's the only like really specialty where there's like a real art to it, and that I liked a lot.
Yeah, that's what I was gonna say. I think it's the most creative version of medical practice, I guess, because it's the only one that you can actually like, have your own taste, have your own touch, have your own style. And
the results are very visible, right? That's the whole point. It's a very aesthetic thing.
For sure.
Yeah.
So you realize like going through,
like
your medical school.
Months and years.
Yeah.
Like I was not, like I said, it was not one moment, one patient. It was like a series of experiences for me.
And what was it like? Obviously you said your father was also in plastic surgery.
Mm-hmm.
Did you like grow up having a certain mindset about it, or was it always like very open, plastic surgery, that kind of stuff, like in your life?
It was always open. So
Yeah.
like as a little kid, I saw my father operate, and so like seeing blood and like a little bit of gore was nothing to me.
Right.
Like I saw it since
Right.
a little kid. But if anything, knowing, having a father as a plastic surgeon, I appreciated what he did. But it made me kind of resist going into plastic surgery because I felt like, am I going into this because it's my father and I want to please my father?
I was going
to
to ask you that, yeah.
So if anything, like I kind of resisted it until the very end.
Right.
But then I realized it's what I really wanted to do. So
For sure.
yeah.
Clothes go out of style, but you know what never goes out of style? Jewelry.
That's true.
You don't agree with me there?
No, I'm agreeing with you. I'm agreeing with you.
Also, just so versatile. I love jewelry personally. Personally, for me, I love jewelry.
I don't always have the wallet to, do what I want to do and purchase what I want to purchase. But that's why I love brands like Every Jewels, where you can get what's trending, or just like cute, simple chains, stackable rings, just pretty much anything to have some really nice jewelry. And it's also very affordable, but very good quality, waterproof. You can wear it in the shower, because if you're lazy like me and I don't like to take off my jewelry, it's always a good thing.
And it's designed by them, so most of the jewelry is kind of like, you don't see it everywhere. So if you're looking to add some new pieces to your collection, or if you have a beautiful woman you have in your life that you want to spoil, you can get her a bunch of jewelry. They have tote bags, they have socks. Just throw in a bunch of things in cart and then add Chemical X at checkout to receive 20% off your entire order.
And I'm curious, and I'm always curious about this when I see plastic surgeons. When you're a plastic surgeon, do you feel like you're more or less likely to get surgery on yourself?
Because you kind of like know what goes into it.
Yeah.
Kind of thing?
I guess. I mean, in my case, less.
Okay.
I don't know. I just don't have that mindset. I've never had any cosmetic surgery.
I think that's what Veronica wanted to do. She's like, "Are you redone?"
Exactly. I know what you're getting at. No,
Are those lip fillers?
I have not. Well, definitely, you look at my lips, you know they don't have lip filler. But I have not. But it's not like I'm against it. I just haven't. It doesn't really enter my mind so much. Maybe as I age, like I'll start to think more about it. I definitely have colleagues who have had it. Like if you go to a plastic surgery meeting, it seems like every second plastic surgeon has had something.
Really? Do you feel like it's more women or more men though?
Both.
Both? Okay.
Both.
Okay.
Yeah. Both. I mean, plastic surgery in general, more women, like 15%.
Do you think it's been changing a little bit?
Yeah, it has. For sure, over the last 10 years, there's been a shift. I would have said 10 years ago, it was like 5% men, and now it's probably 15.
And what do they normally get done?
In men, Botox is very common.
Okay.
Right? And then in terms of surgery, eyelids is number 1.
Okay.
And then liposuction is number 2. And
In
typically
men,
it's
wow.
like that spare tire, the abdomen, and love handles, flanks. That's number 2.
Okay, men, we see you.
Yeah, it's happening more and more. But because men, we definitely don't like to talk about this. Not the way women have recently. We're less open to it. And it's more taboo still.
Yeah.
But it's changing. We're just lagging probably 10 years behind.
Right. I mean, that's true. But it's funny because I feel like we're at a time where like we're most open about. It's weird. It's like it's always like at a crossroads a little bit. I feel like we're the most open, we're the most accepting of how people are and like body positivity and all that stuff. And then at the same time, it feels like we're also the harshest we've ever been.
We're very
judgmental.
I mean?
Yeah.
You know what I mean? So it's like,
especially
which one
with
is
like,
it?
Yeah. And celebrities. Do you feel like celebrities need to be open about their surgeries, or
No.
do you think they have like a responsibility?
No,
in a sense,
not
or
at
do you
all.
think like whatever, they don't have to?
They don't have to. I mean, if you want to be open about it, be open about it. If you want to be private, be private. It's like an intensely personal decision. But you can say that things are definitely less taboo. People are talking more about it.
Yeah.
But there's never been more judgment.
Yeah.
Like you see a celebrity have a plastic surgery and they're literally skewered. Like you see the comments and the negativity. It can be brutal. There's a lot of positive comments.
Right.
But obviously the negative ones have more impact. And because there's no accountability online. So, you can be almost anonymous and insult people online, and you see it a lot. It's sad, but it's the reality that it happens.
Yeah. And that will bring me to my next question, but I think that's actually what fuels a lot of the reason why certain people, especially in the spotlight, do get surgeries, right? Is because of the hate
You're
that they're
always
receiving.
on video. You're always on camera. Like it's hard. Like you're staring at yourself all day long.
For sure. And you're getting a lot of comments from the public eye telling you to fix this, fix that. You don't look good here. This is ugly about you. And I think like are you able to recognize when someone's coming in based off like feedback that they're getting from others? Maybe they're getting maybe it's their family, maybe it's their friends, maybe it's on a grander scale, like they're a social media influencer that's getting a lot of hate out of a certain thing. Are you able to recognize when the insecurity is coming from pleasing other people or if it's really coming from within?
Yeah, most of the time. I'd say like the first question I'll ask every patient is why? Why are you doing this? So if they come in for a nose job, I'll say, why a rhinoplasty? Why are you thinking about a nose job?
Because I have a hunker and I want to get it gone.
Or tummy tuck, like literally anything. Why do you want a breast augmentation? And patients are, in general, pretty honest. you know, and sometimes they'll say it's something that I've been thinking about for years, ever since, you know, I went through puberty, let's say for breasts, and I just never developed. And the other times you get a sense it's not that, you know, it's, you know, the boyfriend or the husband or pressure from friends. But it comes out, eventually it comes out through the consultation.
Right.
And if that's the case, you know, I'll ask them, like, listen, does this really bother you? You know, and patients.
So I'm sure you prefer that they come just them.
Not necessarily. Not necessarily, because if they come with their significant other or a girlfriend, let's say, sometimes it's advice. It's like a second set of eyes and ears that can help them make the decision. But when it's a negative interaction, I can tell. Right. If it's like an overbearing significant other who's basically saying, "Oh, go for the bigger implants," no, pushing the issue, I'll recognize it right away, and I'll push back. I'll say, you know, thank you for your opinion, but you know, it's her decision, and it goes both ways. You know, whether it's man or woman.
Do you think that happens a lot?
Not as often as you would think.
Okay.
So most of the time, for, let's say, and I use again the example of breast augmentation, the significant others are really supportive and leave it to women to make the choice, which is the appropriate thing. But once in a while, I get somebody who's not the nicest guy, and then you have to kind of be, for lack of a better term, put in their place. Yeah,
but I mean, when it comes to surgery, obviously, when you're the person getting the surgery done to yourself, it's obviously very serious, and sometimes people are a little more chill about it when it's just their opinion, and they're very easy to throw around, like, yeah, just get this, just get that, just add on this. And I feel like you don't necessarily realize like the repercussions. Like, this is most of the time a permanent thing that you're doing, right? And it's serious. It's serious.
I think people also see it as like, I'm already going under, might as well, I'm there, might as well get it all done at the same time.
Yeah, but there are consequences. So there is what you want in terms of size, and you can say, well, I want to be this big, I want my breast to be this big, but then there's the potential consequences. So we can get you this big, but what if you have rippling, visible ripples and waves in the implant? What if you have implants that drop too low because they're simply too heavy? What if you get stretch marks? What if all these complications where, you'll have the breast size that you want, but the shape won't be nice at all, and then you're miserable. You're unhappy.
Right.
So it's about making the decisions that to avoid those complications. And sometimes it means, okay, you have to go a little bit smaller than what you would want to have the shape and the durability, like the longevity of the result.
Right.
So essentially what I'm saying is that sometimes you can't have everything you want. Yeah. You have to kind of give up a little bit on size to have the shape and the nice long-term result that you want.
And I'm sure a lot of people come in with celebrity photos that they see and they're like, this is what I want. Well, who would you say is the celebrity people come in asking mostly for? I would think it's Bella Hadid, but...
Yeah, I some of that, but I would say the most common nose is Kim Kardashian.
Oh, right.
And actually, I think Kim Kardashian has a very nice nose.
She redid it like, I think 4 times.
I don't know. Like, I don't want to comment on what she's had done, but I can tell you that overall, she has a pretty nice, natural, proportional looking nose. It's tough to tell because a lot of photos are retouched and she wears a good amount of makeup. But in general, I think it's overall nice. But the problem with that is that she started off with a certain nose, and now she has a result. Somebody could be starting off with a completely different nose and want that result. It's not realistic.
Yeah.
So it's all about the anatomy that you have, like the cartilage, the bone structure, the thickness of your skin, like all these factors that have a significant impact on your final result. And so I can get you from here to here, but I might not be able to get you to here.
Right.
And like the most important part of the consult is managing expectations.
Yeah.
Is to be able to say, okay, you're not getting Kim Kardashian's nose, which I never say, right? But it's about saying, like, I think if your expectation is here, I think I can get you here. And if you're not going to be happy with this, then don't do it.
Yeah. Because it's true. A lot of people see something and they go like, oh, she has such a good nose. But it's like, if you would, edit that nose onto your face, it would look like garbage. Yeah. And it wouldn't suit your face. It wouldn't suit the kind of skin you have, the kind of nose shape you're already starting with. And I think that tends to be like a common issue with like why people are disappointed with surgeries or whatever, because they want something that's not even attainable.
Yeah, and maybe they have a surgeon who has not managed their expectation. Right. Has told them, don't worry, I'll give you what you want. It's gonna be great. Yeah. It's very, very much about managing expectations.
Interesting.
And what about Botox? Does it actually prevent wrinkles? Because I feel like it does.
Yeah, it does. So Botox is a medication, right, that when injected into a muscle relaxes the muscle. Okay. Right? So you can inject a small amount and it relaxes the muscle a little bit, or you can inject a lot and then the muscle doesn't move. So it's used in areas of the face where the wrinkles are caused by movement, right? So that's the forehead lines here. Right? So if you raise your eyebrows, you get lines there. It's when you smile, the little crow's feet. It's when you frown, the frown lines here. And so in small doses, you can use it to relax those muscles a little bit, right? To either improve or get rid of wrinkles, or if you're just starting to see them, to basically eliminate them, and then you won't get them, right? So in those two instances, but it's about dose and location. So it's about not putting too much, using a low dose, because if you eat too much, everything's frozen. Like in Hollywood, you see those people who literally cannot move their eyebrows. They look expressionless. You don't know if they're crying or laughing.
Right.
That's just way too much Botox.
Yeah.
And nowadays, I think the trend is towards a little bit less, so you can still move and have expression,
Yeah.
but have softer lines.
Right. So you're like, did she do it? Did he do it?
Yeah, it should be like that. If you can tell somebody had a surgery or Botox, it's probably not an ideal result.
Right.
Yeah.
Right?
And they put too much.
Yeah.
But I know there's always, I mean, so do you feel like there's a such thing as getting like preventative? Like, and if so, like what age do you say that people should tend to start? Like what's too early?
So
because sometimes I see people who are 22 saying I'm getting preventative and I'm like, relax. But I don't really
agree.
know.
So I'm all for prevention, but there needs to be something.
Right. Okay.
Like you can't have like perfect skin, like not a line on your face and you're young and you're 18, 19, 20 years old and be like, I want to prevent. No, it's just you're way too early. So
you'll send them home. You'll be like, I'm not doing it.
Exactly. So I think you need to have some lines already forming.
Okay.
And the beauty of Botox is you can use it. It'll get rid of those lines. And then if you keep using it, you'll never get them. Right. So at least wait until you have something. The concept of, I don't have anything, but I don't want to get them. I mean, you might not get them for 10 years. So then you're just doing unnecessary Botox for 10 years.
Yeah.
So I always tell people to wait, particularly younger patients. It's
that makes sense.
particularly, I mean, I'd say
what age?
mid-20s, late 20s is
Okay.
when the lines start forming a little bit more, and maybe even more like late 20s.
So Veronica, we're getting there.
We're approaching.
No.
I'll let you know for my.
More late 20s.
I'll let you know for my appointment
More
after.
late 20s, yeah.
So being in practice for 15 years, obviously, I mean, I would say 15 years ago, social media wasn't really, it was just starting out, right? 15 years ago, I'm trying to think.
It's not what it is today. That's for
definitely
sure.
not what it is today. How would you say the difference in, what people ask for, what they're showing, kind of just the energy with plastic surgery? How do you feel like that's evolved over time during this 15 years, during, the rise of social media, the rise of filters, the rise of, editing your photos and all that stuff? Do you feel like there's been a change? And if so, what would you say that would be?
I think people are a lot more aware, first of all, so they're much more informed as to what's out there.
Okay.
Most plastic surgeons do some sort of social media, so there's a lot more information, sharing of information, and education. But on the other hand, there are a lot more filters. There's a lot more judgment, and a lot more like self-expectation. So with these filters, you could look amazing.
Yeah.
But then you look at yourself in the mirror and you don't look like that. So all of a sudden you want your regular face to match that filter, and you become insecure, and it drives you to want to do stuff. I don't think that's particularly healthy. The filters I think are crazy.
Yeah, I think filters for sure is
they can be fun. They can be fun, but it's pretty destructive. Ultimately, there are positive things like the education and being able to see before and afters and life surgeries, those types of things. But then there's a lot of the negative stuff of body shaming and people who've either had surgery or not, who are shamed for their appearance. So all in all, it's a bit of both. Social media has been good for plastic surgery and making it more accessible and open to people, but it's also been a bit destructive in that there's a ton of expectation put on a people and judgment,
Right.
which is not good.
And do you feel like more people are getting plastic surgery now?
Definitely.
Like by a lot?
Definitely. The numbers are increasing.
What's the most common surgery?
Breast augmentation.
Okay.
Breast
and is that your
augmentation.
specialty?
I do a lot. So the two things that I do most are breasts and noses.
Okay.
So yeah.
And what's your particular favorite to do? You're like,
both
both.
are so different. Those two operations I find I'm fascinated by, and they're both so different. Rhinoplasty or nose jobs are super, super detailed, very little margin for error, right in front of the face. down to the millimeter. Breast augmentation in itself is about making decisions before the surgery and making the choice of the implant over the muscle, under the muscle, a matter of proportion, look at the patient's, the rest of their body. So they're both very different, but I enjoy both of them. But since COVID, plastic surgery has increased a massive amount. I think there's a 30-something% growth.
I feel like it has to do. I feel like it has to do with being at home, seeing yourself in the mirror, like really being with yourself so much that you're just like, I can't wait to get out of here and just get everything done. You know, you're just picking on your face.
Yeah, there's some of that. There's the fact that you're looking at your own face on Zoom, so you don't look at your face live most of the time. You don't sit in front of a mirror, and now for hours, all of a sudden, you're looking at yourself. You're at home. You're not spending money on restaurants.
Yeah.
You weren't traveling. You're not spending money on clothes because you're not really going out.
Yeah.
And if you were lucky enough to still have a job and maintain your income, you want to spend on something that makes you feel good. So part of that was plastic surgery. So
that makes sense.
Yeah.
That makes sense. Well, I'm actually interested that breast augmentation is still like one of your most popular surgeries, just because I feel like, you know, the trends obviously change. You know, in the 90s, it was like, you know, big tits, skinny little body. And then like over time, it became like that very curvy, big butt. Everyone was getting like BBLs. So I feel like I feel like right now, where would you say we're like body type trending wise? Do you feel like we're getting away from the BBL body and going more back towards boobs? Or
do you do BBLs?
I do. Yeah.
Okay.
Yeah. Not as much as I do breast augmentation and noses, but I do. I'm much more conservative than, let's say, the average person. I would never try to get a Kim Kardashian type result.
Right.
Like for me, I have a much more kind of natural philosophy.
Yeah. Well, she's been redoing hers to be a lot smaller now. So.
Yeah, but good luck. Good luck doing that without having lumps and bumps and irregularities. Like once you reach that size, like going back is very hard without having
I always wonder
deformities.
how that must be.
You can't just suction it out without having lumps and bumps. It's not going to go well long term. Like if you have one of these BBLs, like Brazilian butt lifts that is really, really big, long term, not good. Not good. And that's part of the reason why I haven't pushed the issue there. And maybe I don't get as many patients to do BBLs because of that, but I'd rather be much more conservative and have good long term results than take the risk of a patient being super unhappy. You know, when you're 70 years old, like what is that going to look like?
And also
or
the
even
thing
60,
is like,
you know?
And the thing is when you gain weight too, you gain even more there, right?
Right.
So it's
still
like
fat.
you can like it at the moment, and then it's like you start gaining weight, and then it's
disproportionate.
no longer disproportionate to your body.
And you can't go back. Implants, you can at least downsize.
Right.
Interesting. I never thought of that.
Yeah. So if the trend is a bit smaller, you can always downsize. It's not that complex, which has been a bit of a trend. So now I think we're more on the smaller conservative side
of breast
than we were
implants.
like in the 80s and 90s.
Right. Yeah. More natural, I feel like.
Yeah. I think overall it's a trend. Maybe not in like Miami, but
it's weird though.
Yeah.
I feel like there's either like super fake, super huge lips, very redone, very tiny waist, big butt, huge tits, and then there's also the like I want to look the most natural. I feel like right now, actually, I would say in the past couple of months, I've been seeing like majority of influencers removing their filler. You know, stopping to do certain things, maybe removing their breast implants, certain things like that. Because I kind of feel like the trend right now is to look as natural as possible.
Yeah.
Whereas for a little bit, it was like to look done.
I think it's like, so it really depends.
I know. I really don't know. I'm just basing
trends.
myself off what I see. I see a lot of people removing filler or doing less or.
Yeah, but the people that get the most attention in social media are the people at the two extremes. Right. So the people with the huge lips or the really, really big implants, but that's not the majority. It's actually the minority. They just get the most attention. So most people are kind of in between, you know, pretty responsible. They want a good, let's say, change in shape and volume, but look relatively natural. You know, it's just those people aren't the ones who get the most attention.
Mm-hmm. And what happens when someone does, let's say, like a rhino or a breast augmentation and they're not happy with the results? Like, how do you go about that? So, does that like keep you up at night? I just try and think like if I'm a plastic surgeon and someone's not happy, I'd be like, how am I gonna sleep tonight?
It's exactly that. So like literally, if you have an unhappy patient, you lose a lot of sleep. It's a very, very, very unpleasant thing because
like even after 15 years.
Oh yeah. And obviously I have less, right? I have more experience now, so I can avoid those pitfalls. But once in a while, you have a patient that's unhappy, and almost always, I'll do a revision or a touch-up, right? if it's realistic. You
Right.
know, rarely I'll have a patient who's unhappy, who I realize their expectation is totally unrealistic, like they're just never going to get the good result, and I'll just say, listen, you know, and I truly believe they have a nice result. Don't do anything. Trust me, it's just going to get worse. And in those cases, it can be a bit uncomfortable. But in most cases, by far, if a patient's unhappy with their result, I'm unhappy with it before they were. Like I recognized before they did that they were going to be unhappy. So then we do a touch-up. And it happens. It happens for noses, for example, there's a 5% chance that you'll need a touch-up. And it doesn't seem like a lot, but it's 1 in 20 if you think about it.
Right.
So it
And
happens.
if you're doing,
It
how
happens.
many do you do a day about?
I'll do, let's say per week, anywhere from like 7 to 10
Okay.
per week.
Okay.
You know, so 1 in 20, it happens
Right,
for sure.
right.
And
I
you have
feel
to, you can't, you can close your eyes and try to ignore it and try to convince the patient, no, wait, think about it. But ultimately, you have to take the bull by the horns. You have to fix it.
And would you say like it's something like you're mad about because you feel like you could have done it better? Or is it the type of, let's say, like nose they had, or when you went in, you realize like their bone is a little more, I don't know, thick?
So
Or...
I always feel like I could have done it better. Like,
Okay.
it's literally like almost every
Okay.
case, I always see tiny little things and details that
Okay.
I could have done better. It's just the way I think in my personality. It's a bit obsessive. But,
Right.
But if you're asking, like, is it something that I did, let's say it's my fault that I could
Yeah.
have done better, that led to the bad result, versus like how they heal or how they scarred
Right.
or, you know, something that's out of my control, oftentimes you don't know. But ultimately, I try to kind of not think about it that way.
Yeah.
Because it doesn't matter at that point. You just have to fix it.
Yeah.
So whether, you know, and the last thing I want to do, if I don't feel like it's me who did it, is say, well, it's the way you healed.
Right,
Like,
right.
That's not appropriate.
Yeah.
I'll never. It's my responsibility. So I don't think of it that way. I'll just say, you know what? No matter the reason, let's fix it and find a solution.
And I think it's better to be safe and do less and go in a second time than, because
Do
it's
too
hard to
much.
undo, let's say, a nose that
You took too much away
you
from.
took
kind
too
of.
much
Yeah.
away from.
Agreed.
So I would prefer that anyways, to go
Yeah.
in a second time. I know it's annoying, but
Do you feel like noses are the surgery that has the most revisions?
Probably.
Because
Probably.
I was thinking that just because it's like you see it and it's
And it's
such
in the
something that
middle
you
of your
like
face.
Well,
you
okay,
see
so
every day.
I'm not sure they have the most revisions because even breasts, you have about a 5% rate, but they're the most difficult revisions.
Okay,
They're the most
interesting.
difficult because going back into a nose, there's scar tissue, the anatomy is not the same. It's just technically more difficult to do. So it may not be the most percentage-wise, but they're the most difficult ones.
Interesting.
Yeah.
Interesting. Back to BBLs. So would you say that we're kind of like straying away from that trend right now and going in a different direction?
Yeah, a little bit. I think the trend is changing. I mean, you see a little bit less of it on social media. People are trying to reverse their BBLs, but people they've also realized that out of all the surgeries, the one that's a little bit more risky,
Right.
cosmetic surgeries. There was a study that came out a couple of years ago that showed that the chance of you dying during a BBL is higher than during other surgeries.
Yeah.
why is
you know,
that?
Well, because you're basically injecting like a large volume of fat into
Right.
a small area. And what was happening is that when the surgeons were injecting very deep, there was a chance you could inject into a vein, and the fat would go into that vein, then into your lungs, and potentially could be deadly. Since then, though, things have been refined. People are injecting less volume, not really
Right.
pushing the issue, and injecting more superficial. So it's become a much more safer surgery since. I definitely don't think it's an unsafe surgery. I think in the proper hands, it's a safe surgery,
Okay.
done properly. But if you compare it to other surgeries, it's probably a little bit less safe.
Yeah.
I guess.
And what are your thoughts on people going out, like in different countries, like Turkey, Colombia, to get BBLs? Like, what are your thoughts on
Or
that?
any cosmetic surgery.
Yeah, any
actually.
cosmetic surgery.
I'm not completely against it, provided they know and they've vetted the surgeon. They know people who've had surgery from that surgeon. They know they're properly accredited, in that country and have their license. But I think the real problem is that you go to some of these countries that don't have the same level of quality control in terms of training. So the level of training of some surgeons isn't up to par compared to North America. So that's one issue. You don't really know what you're going to get. But there are good surgeons. There are good
Right.
surgeons in Turkey. You can go to Mexico. There are great surgeons that I've met. The problem is quality control. You don't know,
Yeah.
right? The second
especially
thing is,
with a language barrier as well. Sometimes I feel like things can get,
yeah,
especially in research and all that stuff when you don't understand.
Well, just also being able to communicate what you want
Yeah.
in something super detailed. Like if there's a mixed message there and you won't get the
Google
results you want.
Translate.
Yeah, Barbie
Yeah.
knows.
And then so the surgeon can also do a good job, but then you end up with a complication and you're on the airplane on the way back, or you're back in North America, and who's going to take care of you?
Yeah.
You have these open wounds and infections, and it can be pretty complicated. I've seen patients from other countries with pretty bad complications that take like weeks or months to heal, and you can only kind of try and fix them months later. It's pretty bad.
And the thing is, it's like if you get sick from this, it's not even like you can hop on a plane and go.
Yeah, like how does that work? Do
How does
they
that work?
come to, like, let's say, would they visit you as like another plastic surgeon in the area, or do they really need to see their doctor?
Usually they come back, right? And the complications are basically dealt with here.
With another plastic
like
surgeon.
With another one. So they'll call my office and say, would you take care of this complication?
Right.
Usually I'll say yes, because I'm not, at a certain point you can't turn away a patient. Who are they going to go to? And
Right.
Yeah.
So I will
It's a lot
say
of
yes,
pressure.
Yeah, I know, it's scary.
But it is a lot of time and effort to take care of these patients that you see, let's say, every week for several weeks. But that's because part of being a doctor is I can't turn away somebody who's really, really in need with a bad complication.
Yeah.
And then you wait, and then they heal, and then you fix them 6 months later, basically.
Really? Like
Yeah.
they get it redone or whatever.
Yeah. And the problem is some of these complications are not totally reversible, right?
Right.
So if you have a bad result because of a complication, you can't always get the result you expected to get.
Yeah.
Right.
That's
and a
true.
revision is always, I guess, more expensive if like
And
they're
more
not the
difficult.
doctor who.
Yeah, almost always.
Yeah.
Yeah, because it just takes so much more time in the operating room to fix.
I mean, I heard some crazy stories. Actually, recently I heard of a story of a girl who went to, I'm pretty sure it was Turkey, to get a BBL. And basically when she came back, she went to see like her actual doctor, just like check up on her health and make sure everything was good. And they had basically informed her that she had died on the table, and they resuscitated her, and they were able to tell from like where there was bruising on her body. And they were able to tell that like she was resuscitated during her surgery, and they never told her about that they never like woke her up and told her like, hey, by the way, like you actually died on the table. We had to resuscitate you. She only found out when she came back to Montreal, saw her doctor, who then was able to be like, by the way, like this bruising here is what happens when you are like with the defibrillators.
Yeah, I guess. I don't know.
Fact
That'd be
check?
crazy. Yeah, I would check that fact. I don't know. It'd be tough to tell. Defibrillators can leave burns because
Right.
they're paddles and they're rectangular.
Yeah.
So if she had the actual burns, like one here and one on the back, yes. But I have a hard time believing that story is totally accurate.
Interesting.
Has anyone
That's
ever
what I-
died on your table?
Never.
Okay.
never.
Scary.
I had to ask that.
This is the type of thing that makes the news. I mean, it's not,
Yeah.
when a patient dies during cosmetic surgery, it makes the news, and it should. It's a disaster, and typically there are a lot of mistakes, human errors made leading up to a patient death. It's very rarely the patient has like a hidden congenital heart issue that kind of rears its head during a surgery. It's almost always a bunch of mistakes made not necessarily by the surgeon, but by, let's say, anesthesia, the nursing, a little bit of the surgeon. Like it takes multiple human errors to lead to a patient death, and it's an absolute tragedy. But
Interesting.
I have a great team, and this is what we do. We do cosmetic surgery. We do these procedures, and so the lead up to the surgery, the preparation, the blood tests, the heart test, like everything that we do is to avoid that type of thing. There's always the same anesthesiologist. It's just so that there's no miscommunication and nothing is missed.
There's a lot of comfort actually in just knowing that, like it's
Manageable, I guess.
Yeah, and there's a lot of complications that have to happen for you to die.
Yeah.
I feel like we go into it and we'll be like, okay, well,
The risk, it
the
feels
risk
like
feels like
so big.
90%.
Yeah.
No, from a statistical standpoint, you're more likely to die in a car accident than you are on the table and you're having a cosmetic procedure.
Interesting.
So, is it a fear? Yes, patients always fear going under general anesthesia or going to sleep. But is it a rational fear? I mean, are you afraid to get in your car every day?
Yeah.
Yeah.
That's
So,
very true. So spring's here, summer is around the corner, And you know what season that is? It's the kind of season where the last thing you want to hear on a Sunday morning is someone mowing their lawn. But let me tell you what beautiful, quiet sound that you do want to hear. And it's your boy mowing his lawn in the bathroom in a nice, clean area, as he should. You know what I mean? So girls, guys, if you want your man to have smooth balls this summer and have his lawn mowed, then head over to Manscaped because they have everything for below the waist grooming for men, including their Lawnmower 4.0, which is going to keep their little balls nice, soft, smelling good. Literally, they have everything you need for a very unsweaty, unsticky summer.
And we know summer can be very sticky. There's a lot of areas in the summertime that need focusing, and we don't want this one to be one, especially that we have a solution for you.
Exactly.
So head on to Manscaped and use our discount code ChemicalX at checkout to receive 20% off your entire order and free shipping. So ladies, men, there's no excuses. Like, is being put to sleep like more dangerous than anesthesia? Like being awake, I guess, but just...
So there's local anesthesia, where
Right.
you basically, like, to remove a mole or a smaller procedure, you inject something to numb the area, and you just cut it out and close it, right? You don't feel anything, but you're totally awake, totally with it. There's sedation, right, which is where you get an IV, and you get a big cocktail medication, and you're basically out, but you're breathing on your own. There's, like, no breathing tube. And then you can do surgeries that are quite invasive, but not as much as with general anesthesia. General anesthesia is like when you get so much through the IV that you stop breathing, but you have the breathing tube and the machine is breathing for you. That's like the deepest form of sleep.
Okay.
In the past, it wasn't quite as safe as the former ones, right? Being under general anesthesia had a certain risk. It still does, but it's just as safe as sedation now. So the medications have changed, the techniques with anesthesia have changed to the point where it's just become so safe. As long as you're healthy, the chances are ridiculously low of anything bad happening. It could happen, but super low.
That's scary. I didn't know you had a breathing. I don't know why I didn't know that you had a breathing machine when you're on.
If you're really, really deeply asleep, you're in such deep sleep that you're not breathing anymore.
Yeah.
Like when
you don't feel anything. You don't feel any pain.
Right.
And there's the ventilator that's breathing for you.
Right. Like
scary.
when we did our noses, we did what?
Sedated.
Yeah, it's
We were
always
just-
it's almost always sedation.
And does anybody ever wake up during a sedation?
They don't wake up in the sense of like being up and like, hey, what's going on?
Yeah.
But they may start moving a bit. They may say a couple things. You're super, super groggy and drugged. So by waking up, yes, that that can happen. But
What's
but
the
not in
weirdest thing
sense-
someone's
Yeah,
ever
what's
said
the
to you?
weirdest thing someone said?
Oh, I've had, usually not inappropriate, but one time, patient divulged, like, as she was going to sleep to have whatever procedure, like, I'm leaving my husband. Like, boom, and then she was asleep, and everybody in the operating room looked around like,
Oh my
"Where
god!
is
I
that?"
got her.
Yeah.
That'd be my biggest fear. You know, like you're
yeah.
so afraid you're gonna say all your secrets.
Yeah.
No, usually it's not the case.
Yeah. Well, I actually remember in my surgery, like there's certain moments that I could like remember things. I guess like I remember feeling my bone breaking, but not the pain. I just
Same.
felt like the pressure, and I guess
Yeah.
because it's such a high
Because
intensity moment.
That's the last part of the operation,
Okay.
right? It's the last part. So typically we start to decrease the dose of anesthesia to wake you up. And it's the one where you kind of feel like a tapping.
Yeah.
So it kind of stimulates you to
I
wake
remember
up.
that.
I remember.
But
I
no
remember
pain, though.
I remember him being like, close your eyes. And I was like, why? Why
Yeah.
don't I close my eyes?
So
And then my eyes were
but
closed.
that level of being like conscious is less usual, right? So nowadays we're using different medications than a few years ago. So now patients are even deeper than they were a few years ago.
Wow.
So that type of thing is even more rare now than it was.
Yeah, I don't remember anything, but I mean, I just remember like vaguely that one moment, and then
Yeah.
that's it.
So there's two types of rhinoplasties. One that's open,
Yeah.
and the one I think that we did, which
That's
is
closed.
Closed.
So the difference, they're both good techniques. Like I'll do both of them depending upon what the
Okay, you
patient
do
needs.
both.
Yeah, I do
Okay.
both. But the only difference is when you do an open, there's a little scar, a little cut at the base here in the skin bridge between your nostrils called the columella, and you can open the tip of the nose. It's really people who have a really super droopy tip that need to put a little cartilage graft, like a piece of cartilage, to push it up.
Okay.
Or other really complex reconstructive cases. But all in all, like they're both good techniques. You can get great results using both. It just depends on the patient and what they want.
Okay.
A closed rhinoplasty, it's just incisions on the inside of the nose.
Yeah.
So there's not this little scar here, but that little scar is like imperceptible.
Right.
Interesting.
Okay.
Do you feel like rhinoplasty is like the easiest surgery to heal from?
It's one of the less painful surgeries. So for sure, like if you have body surgery, breast augmentation, tummy tuck, liposuction, I feel like there's more discomfort there. So you're less likely to take pain medication with a rhinoplasty. But the unpleasant thing is having your nose completely blocked.
Yeah.
Because you have a little plug, a little sponge in each nostril. You have a splint tooth, a plastic cast. It's that swelling and bruising and discomfort of being plugged up.
Yeah.
That
on
is
the
annoying.
face too.
Yeah.
It's
So it's unpleasant. It just throbs. So it's more unpleasant than I would describe it as pain. We still give you pain medication, but it's not pain. I'd say it's more discomfort.
Uncomfortable for sure. Yeah. Definitely not painful.
So somebody asked, how long does it take for a rhino bone to fully heal? I'm so scared of accidentally moving it.
4 weeks.
Oh.
4 weeks.
So 4 weeks. So bones in the face will heal faster than the rest of the body.
Okay.
But in the rest of the body, it's 4 to 6 weeks. So at 4 weeks, you can be pretty assured that those bones are healed in place. If there are cartilage grafts that they've placed in that are sutured in place that are a bit more delicate, it can take a bit longer, like 3 months, for it to be really solid. Like you wouldn't want to take a hit to the face if you had cartilage grafts. But all in all, just for the bones, like to be able to wear glasses and stuff, it's really 4 weeks.
And for the most part, for someone to be like happy with their nose, how long would you say swelling lasts?
So to be like socially presentable, like if you have a nose job, most people will hide for 2 weeks. Because there's visible bruising and swelling for about 2 weeks. It's obvious. Like if you bump into somebody you know, they'll be like, what happened? But
when you really hate your nose, you're going out after 2 weeks and you think it's so nice. And then you look back a year later and you're like, why did I leave? I look like a zucchini.
It's just puffy.
Yeah.
So 2 weeks, you're seeing like 70, 80% of your result. But there's still that 30% of swelling.
Which is still big.
There's that lack of refinement. But if you ask people that you know, they won't notice.
Yeah.
In general, people aren't very perceptive when it comes to other people's noses. So you can go out, you can be pretty sure that people aren't going to notice. But the rest, that last 20, 30%, takes months and months and months. So if you look at your nose a year after compared to 2 weeks, there's a big difference.
I think that's when the magic happens. Those last like couple of months.
Depends what you're starting with.
Yeah.
I was taking before and after pics when I saw my cast on. I was like, this is amazing. Look at this. Like I couldn't even see I had a whole cast on my nose.
What are your thoughts on hip fillers?
So I think what they mean is those hip dips on like the lateral side of the buttocks. It's an area that you can fill with fat or fillers. The problem with fillers is you need a lot, right? Even a little hip dip, like it's a big surface area.
Yeah.
And you have to constantly do it.
Yeah, so there's a couple of different types of fillers. There's Sculptra now, which kind of stimulates your own collagen production. That can give a bit of volume, but you have to put in multiple vials.
Okay.
And it's expensive.
What around roughly?
Well, I mean, you're talking like usually about $8,000, let's say on average. Like
and it's going to go away.
And that lasts
2 years. Oof. 2 years, and it gives, more of a subtle result. So the hip dips can't be too deep or else you won't see much of a result. But it's typically, you'll use fillers in patients who don't have fat elsewhere. Because you need a good amount of fat elsewhere to be able to get that fat to inject it.
And what about just like eating McDonald's for like 60 days and getting that fat and then transferring it?
Yeah, you can do it. Yeah.
Okay.
Sometimes a patient who's on the cusp of being able to have, let's say, a BBL because they don't have enough fat elsewhere, I'll tell them you have to gain 10, 15 pounds. And then we'll suction that fat out from those areas and inject it. But you can use for like smaller contour like dips or for a little bit of volume augmentation of the buttocks, like something like Sculptra or even certain hyaluronic acids. The most common fillers that we use now are starting to come in bigger formats now. So instead of like a 1 cc syringe, which is like a tiny, they're starting to come in bigger formats. But that's just starting now.
I just like imagine like a cartoon syringe, like such a big.
No. It's like the difference between this big and like this big, right? So.
I have a question actually about a procedure that I feel like is a little bit controversial right now. But we've been hearing a lot of people getting like threading, like the fox eye threading. Is that something that you perform? Is it something that you recommend? Because I've personally on my end seen a lot of people getting it. It doesn't work. It leaves like crazy scar tissue in the face. So What's your opinion on that?
I would say the most common reason why people are unhappy is it simply doesn't hold. It doesn't work. So 2 months later, the effect is done. And so these thread lifts have been around. They became popular like in the early 90s.
Oh, okay.
So almost the identical technology came out in the early 90s. And it came and it went because it simply didn't hold.
Right.
Like the results were so short-lived. They tweaked the formula a little bit, and fast forward like 30 years, it's back. But most people don't remember what happened 30 years ago because most people were in practice 30 years ago or not in practice anymore.
Right.
I had a father in plastic surgery. So I remember the early 90s and hearing my father speak about these threads and be like, they don't work. 2-3 months later, the effect is gone. In most people. In some people, yeah.
Yeah.
But in a lot of people, it doesn't work. So I didn't adopt it. I wasn't a believer to begin with because I knew that it had failed 20, 30 years ago. Maybe it's a bit different now. But I see enough people now to start to realize that there's a good percentage of people where it doesn't work effectively. And whether that's the people who are doing the procedure or that's what the actual technology isn't working so well, I don't know. But I'm not about to adopt it because if something works in 50% of people or even 70, like to have 30% of people unhappy,
it's a lot.
It's not good.
Imagine you're having a trouble with the 5%.
Yeah.
So we're staying around.
There's a lot of sleepless nights. No, so I'm not interested. Not the technology the way it is now.
Yeah.
Best way to get rid of under chin fat, double chin.
If let's say you're a younger patient, okay, and there's not any sagging skin, it's literally just a little bit of bulging fat, like a double chin, then the most effective way to remove the most and to see the most. The biggest difference is to do liposuction, right? So you're making a little incision like 0.5 centimeter under the chin, the scar's all hidden, and you suction the fat out, right? It comes out and it's out, that's it. The only risk there, like any liposuction, is you end up with little contour irregularities, right? Less than 5% chance, but it can happen. That's the downside of liposuction. And it's a minor surgery, and you'll bruise and you swell a little bit for about a week or two. Right?
But it's not dangerous.
No, it's not. It's not dangerous in the hands of somebody who knows the anatomy, right?
Right.
You're way more superficial than all the important nerves and arteries, and it's not a high risk area if you're really under here.
Right.
The other thing, let's say, if you have just a little bit, it's not quite as effective, but works quite well in most patients. Is Balkyra. There are these injections that dissolve fat. You have to do multiple treatments, typically, let's say 3 on average, separated by about a month. But it is pretty effective.
Is it permanent?
It's permanent, yeah.
Okay.
Yeah, it's permanent, but it doesn't remove as much as the liposuction does. And you can still bruise and swell a little bit, but technically it's not surgery, right? They're just injections, so it's less invasive. But it's a good option in some people as well.
Interesting. And I have a question. I feel like now a lot of people get their fillers and their Botox done with like nurses. But then there's also, because I think you can have like the license to do it as well, just as a registered nurse or like a cosmetologist.
No, it has to be a nurse.
Has to be a nurse
or an MD.
Okay.
So there are a lot of nurses doing it. There are a lot of very, very talented nurses. Like at my clinic, I have Jessica and Christina, 2 people who basically do it full time. They've been well trained. They have tons of experience and constantly are going to conferences and learning. So there's that side. I think there are a lot of talented nurses out there to do it. But then there are the ones who are doing it very, very part-time with very little training, like out of their homes. And that's where I have a bit of a problem with that.
Right.
So I think if there's oversight from a doctor and it's done at a proper clinic with if you trust the clinic, you trust the doctor, chances are you can trust the nurses.
Right.
That's the best way for me to put it. But
do you do it as well, or do you stick more to surgery?
No, I still do it.
Okay.
I still do it. I do more surgery than I do fillers and Botox, but I still do it.
Okay.
I enjoy it, and having the whole team do it, me still being involved with the nurses and all that, creates a better environment.
Yeah, for sure.
So I'm still very much involved with that stuff.
Okay.
And also, I feel like plastic surgery is a little bit like how tattoos are. When people say like you get one tattoo and then you want to like get a whole sleeve, it's like almost like a bit of an addiction. And I feel like some people get a little bit of filler, they start realizing that they can adjust certain things about their face, and then they do more. Do you recognize that in a patient when you feel like they've gone too far or they're doing too much? Do you ever refuse them for those reasons, or do you ever tell them like, look, I think you should stop? Or
all the time.
How do you navigate that?
All the time. And I probably
it's common.
I probably lose patients because of it. But ultimately, it's my reputation, right?
Yeah,
and I want to keep them safe, because if you inject too much, you can end up with lumps and bumps and things that are irreversible and difficult to fix. So I'll do it all the time. I mean, there's a limit. And whenever somebody's like ridiculously over-injected, like massive cheekbones, and they're disfigured because of the fillers, it's always the practitioner's fault. It's always the injector's fault. I don't care if the patient's pushing and wants more. It is the responsibility of whoever's injecting to say no.
Because it's on you after. It's your
reputation.
You don't
realize you're looking. It's a gradual change. Like you become blinded, like a little bit more, a little bit more, a little bit more, and you don't even realize that you're becoming disfigured. It's a normal human phenomenon.
Yeah.
So as an injector, it's your responsibility. You have to.
Totally agree.
What would you say are some red flags when looking for a doctor?
Make sure they're accredited. So let's say in Canada, the Royal College of Surgeons and Physicians of Canada, in plastic surgery, or dermatology, let's say, there's some GPs who inject and they're very talented, but let's say at least have them be accredited in their specialty, that they're well trained and have a lot of experience, that they've done a lot of patients, that they have good recommendations. Knowing patients who've had treatments from those surgeons or other doctors is the most powerful thing.
Like recommendations.
Yeah. Person to person recommendations is probably the most important. You can go look at online reviews.
Yeah.
Like Rate MDs and things like that. It helps to paint a bit of a picture. But I know for a fact that some of them are not totally accurate.
Yeah.
So I've seen surgeons who were like 5 months into practice and all of a sudden have like 300 reviews.
Yeah.
And I'm like, I know you haven't even done 200 surgeries in your life.
Yeah.
And you have 200 reviews.
Yeah.
Like there can be a bit wishy-washy there, but it gives you an idea, right? If somebody has a really, really bad rating, then you might want to look into it a little bit. But ultimately, like talking to patients and looking at their before and afters, let's say online.
Yeah.
I
feel like our generation, or especially me, if I'm like looking for a doctor, which is probably the worst way to be, is I'll look on social media. I'll be like, what have they done before? Which is fine to just, I guess like start it off, but then you should do like obviously the work with looking at reviews and
go meet them. Sure. Because sometimes you'll go and you'll have like an immediate trust. You're like, I trust this person, they seem honest, and they told me all everything, the positives and the negatives.
Right.
And there are other ones where you might meet and be like, no, this person is,
you got
I don't feel like I can trust them. And so it has to be a feeling too during the consultation.
Yeah. And I've heard a lot of, especially I know this happens a lot in Turkey, where the doctors will like edit their before and afters. So like edit the after
that's a great
photo.
Question.
And like I've really seen that being a thing where like patients will go and talk about it later and be like, these are not the real results. They edit their results.
Or like they'll even do it without a light, and then the day of
makeup,
of the makeover, it's like the light.
So for sure in plastic surgery, when you go to the conferences, there's a big deal to basically try and take it in the same position with the same light, with no makeup, all these things. Sometimes it doesn't work out perfectly because you're in a different room, and
for sure
you might not get that exact situation, but you do your best. To alter a picture with like Photoshop, crazy. I think that's crazy.
It's just
dishonest. It's fraud. But different lighting, it's a bit more gray. Sometimes patients will show a pre-op picture that's taken clinical against a white background with no makeup, and then the after pictures of them at the beach looking fully glamorous with makeup. Well, of course. So most people recognize that and they take it with a grain of salt.
Yeah.
I wish everybody would show the exact same before and afters.
What if someone comes to a consultation and they don't know what they want to fix, but they're like, doctor, fix me. What do you think I need? What are your thoughts on that?
I will literally never recommend it, a surgery.
Because what if they never had that insecurity and now you brought it?
I would never do it. I would never do it.
You wouldn't tell them like what you think they would need in order for their face to be more balanced.
Nobody needs cosmetic surgery.
Right.
It's not a need. Everybody's normal. There are differences in people. I'll always say you don't need anything. If there's something that bothers you, you can tell me, and I'll tell you if you're a good candidate based on what you think you want, but I will never recommend it.
Okay, because there are doctors that I feel like do that. They're like, well, you're already going under, like you're doing your nose, might as well like align your chin or whatever.
That's the one exception,
right?
Where very rarely I will. If, let's say, they have a really protruded chin for balance. But other than that, never. Like literally never. And even rarely the chin, I'll mention. Okay. Just because you said, if it's not the patient's insecurity, like they have no problem with their chin or their body, like why are you creating that?
Yeah.
Right.
It's not fair.
Yeah.
And I think that's an interesting like perspective on it, because I feel like, people tend to say like, oh, plastic surgeons, and obviously it's kind of negative, but I feel like people almost put the blame on plastic surgeons, say, oh, you're creating an unrealistic beauty standard. But do you feel like in a way you're also helping people? Because I would say for me personally, like getting surgery was like a really helpful experience, and I don't feel that it was negative for me at all. I feel like if anything, it helped me become like a better version of who I am. It helped me be more confident. But then there's obviously the extremes where people have like more toxic version of that experience. So how do you feel like the plastic surgery industry kind of has an effect on beauty standards and people? Do you feel like it's more helpful or more negative in a way?
It's a bit of both.
Right.
So the best way I could put it is everything in moderation. If plastic surgery is done in moderation, it can be done responsibly, and I would say in most people it's helpful. But there for sure is such a thing as too much of a good thing. And expectations do get higher, and people compare themselves to somebody who has had a nose job or a breast augmentation, and that can be a slippery slope. So there's a lot of good that comes with plastic surgery, but it for sure sets the bar a little bit higher in terms of beauty standards. But it's not just plastic surgery, right? It's also the filters.
Yeah.
It's makeup. It's the fashion magazines. We're not the only culprits in setting that bar super high, particularly for women, more for women than men. There's a lot more pressure, I find. So it's about balance.
Yeah.
That's the way I look at it. There's good, there's bad that comes out of it. For the most part, it's incredibly helpful. It can give people a lot more confidence and make them feel better about themselves. So. And
for the most part, people do use it in moderation. And it's like you said, I mean, I agree with you. It's like you said, there's makeup, there's all these other things, extensions, like magazines, social media, all these things all play into beauty standards. And I think like when it comes to plastic surgery, like sure, some people could look at it and be like, oh, well, you're promoting changing yourself, you're promoting these things, but there's so many other factors that are promoting a certain beauty standard. Plastic surgery just happens to be an outlet to
They're all changing your appearance. There's a million ways to change your appearance other than plastic surgery. The way you dress, your makeup, filters, extensions, eyelashes, like brows. And plastic surgery is just the more definitive way of doing it and tends to affect a bit more of a change. But it's not the only thing, for sure not.
I mean, it's like we don't go to orthodontists and say, you're setting a beauty standard of straight teeth. You know what I mean? Like, I feel like, but it is a beauty standard. But like you're helping people become more confident. So
obviously they could also like argue that it's like a health benefit.
Not teeth braces.
Yeah. But I think the difference is like in orthodontics, there's not much cutting, right?
Right. There's no less risk.
I think there's a sense like, well, you're cutting into the human body.
Yeah.
And that in itself like rubs people the wrong way.
Yeah. And it's like, that's what you were given. That's what you should have.
Yeah. So I get it. I get that perspective, but I've also recognized that it helps a lot of people. So.
Yeah. Are there any breast cancers linked to implants?
Not the ones we use these days. So there was a period of about 15 years where some people were using what we call textured implants. So most implants have a smooth surface. Whether they're silicone or saline implants, they have a smooth surface. And they're called smooth implants. There was that period of about a decade and a half where the companies developed these implants that were textured, meaning they had like a fuzzy surface. And they were meant to kind of Velcro in place and to kind of stick in place better than the smooth ones. What we realized after like a couple of decades they existed, was that there's a link between the texture, not the actual implant, but just the fuzzy surface of that implant, and a very rare type of cancer called lymphoma. That happened to be very, very, very low grade cancer and very treatable, but still a cancer. So essentially those implants, half of them were taken off the market. Nobody really uses anymore. And we're back to smooth implants, which are good. But there was a period of time where, there were some implants being put in that had this link. Most patients have decided to take those out and switch to smooth implants. So not anymore. Basically, the answer is not anymore.
Right.
Okay.
And I've been hearing about a lot of people, obviously I clearly get my information from social media. I've been hearing about a lot of stories of people saying, their breast implants made them sick or depressed or all this stuff.
I've heard that too.
Yeah. Is there any, fact behind those claims or...
So, like in the last few years, like a hot topic on social media has been breast implant illness. That's what you're describing. So, breast implant illness has like kind of a nebulous definition, but there is a subset of patients who feel like their breast implants are giving them aches and pains, joint pains, swellings, inability to concentrate, brain fog, rashes, a lot of different things. And the plastic surgery community was always doing research on implants. All the research that's been done and looked at like hundreds of thousands of women's, like big cohorts, big studies, have not shown a link between these type of nebulous symptoms and the implants, right? So to this day, as a scientist, you could say there's no link. But I will say that sometimes the studies miss the link, right? So if a study is not big enough, or if there's a really rare disease, sometimes it misses it. Studies aren't perfect. I've seen a few patients in my career, not necessarily my patients, but patients that came from elsewhere who describe these symptoms, and the treatment is to take the implant out with that thin layer of collagen that forms around the implant, right? And those patients magically got better after, right? So all these symptoms kind of went away. I think there's probably something there. Breast implant illness maybe exists, right? If you ask most plastic surgeons, I think they'd probably say no. I'm a little bit more on the other side, but I can't be sure.
Yeah.
Right.
Ultimately, if a patient feels that they have it and they have implants, I'll offer an explantation, removing the capsule, and then you have to just cross your fingers, because if it does exist, then it'll work. It'll get better.
Right.
But if it doesn't, then what was it? Is it your thyroid? Is it menopause? Is it some other hormonal imbalance? Is it another disease that can give these constellation of symptoms? That's the problem, is there are a lot of other things that could lead to all these symptoms, and it kind of gets mixed up in gray. So somebody who, let's say, has implants and all of a sudden they get these symptoms, well, they may be going through menopause, but automatically it's the implants and not menopause, or their thyroid. So it gets mixed up a little bit.
Yeah,
I'd say a lot of the cases that are out there are probably not breast implant illness, but some of them are.
Yeah.
Right. How often do you have to redo a breast augmentation? Let's say, because after, 10 years?
That was the old rule.
Okay.
Oh, that was the old rule.
Implants used to have a shelf life, right? Because they only lasted for so long before they ruptured. So every implant, if it stays in long enough, is going to eventually rupture, whether it's silicone or saline.
Okay.
The good thing about the silicone implants now is they're that gummy bear, right? Implants. So basically they're cohesive. They're not like a liquid silicone that leaks. So if an implant ruptures, it kind of keeps its shape. So you can have an implant ruptured in place for a few years and be relatively safe without leaking. What we do now is every 5 years, I send my patients for an MRI, which is a scan, to make sure there's not a little crack in the implant. And if there's not, then we wait another 5 years, and then another, and then another. So in theory, you can have implants for 20, 30 years or even longer. As long as the implant's intact and you're getting your scans every few years, then you're fine.
Interesting.
And do you recommend getting a breast augmentation after having children? Or
Depends how close you are to having children. So if somebody comes in and they're 20 or 23, 24, and they're motivated and they want to do it for the right reasons, and they don't know when they're having kids, then they can have it before, right? Because it could be half a decade or a decade before they have kids. But if let's say it's somebody who is like, well, I'm going to have kids in the next year or so, then I'll tell them to wait. Because there's certain changes, right?
Yeah.
So your skin can get stretched, your breasts can lose volume, they can sag, and then you'll need some sort of revisional surgery or maybe even change of implants. So in those cases where you're close or you're doing it soon, wait till you're done with your kids, and that way you'll avoid another surgery. But otherwise, no, you can have it before kids. It's safe. It's safe for breastfeeding. It's safe during pregnancy to have implants. So.
Interesting.
What is the cost for a mommy makeover? But what's also included in a mommy makeover?
So usually it means you're having a breast surgery.
Okay.
Most traditionally a breast augmentation and a tummy tuck.
Okay.
Right? But it can mean a few other things. But traditionally, breast augmentation with or without a lift and a tummy tuck. A tummy tuck can run anywhere from, let's say, on average, let's say not my prices, but on average, 10 to 15,000. A breast augmentation typically runs around 10,000 plus or minus. If you're doing a lift with the breast augmentation, it's another few thousand in addition. So you do the math, it can run around, let's say, 20,000 for both. But that's typically what the mommy makeover means. It's a breast surgery and a tummy tuck after having.
And it's done at the same time.
It's done at the same time.
Okay.
Yeah.
Two birds, one stone.
So my last question was going to be, what advice would you have for anybody that might be considering surgery? Maybe they're not 100% sure on their decision yet, or they're just considering. Is there any kind of advice that you have for somebody that might be in between doing it?
Yeah, don't do it.
Okay.
Really don't do it. So if you're not 100,000% sure that you want to do it and you're not motivated and you're not doing it for the right reasons and you're not totally convinced, just simply don't do it. Just take your time, talk to friends, go for another consultation, get second opinions. Do what you need to do to convince yourself, yes, I'm doing it, or no. Right. But if you're on the fence at all, do not do it.
Okay.
Because I can tell you from experience, is those patients that are on the fence, if you end up doing it, they're the ones who end up unhappy because they were never sure to begin with.
Exactly.
It's so true, though. Like, when I think back to getting a nose job, I hated my nose so much that I was like, whatever I get, I'll be happy with because it'll be better than what I have. Yeah. So I think, when people go in and they're just like, I don't know if I should do it, then it's like, you risk maybe they're not going to be happy with it.
Yeah, don't do it.
Especially when they're not, like, I have a lot of people that will come to me and be like, oh, like, I just want to, like, change this, or like this little thing I don't like. And I'm like, you can end up with so much worse than what you have now. And like, you need to be ready for that in a way where it's like, you can't start going in and saying like, I really don't like this tiny little detail. It's like, once you start searching for perfection, that's where you're going to be unhappy, I feel like.
Yeah. And those are red flags in the consultation. Yeah. If the patient's too detailed in terms of the result that they want, I'll be honest with them and frank, and I'll be like, listen, you're looking at this in way too much detail. You're never going to get that level of detail and definition. You have to be more accepting of a small range of results. And if you're not, then don't do it.
Right.
Yeah. Yeah. Somebody asked if you would be your own client.
If I'd be my own client? Yeah. In what? For what?
I don't know.
What are they suggesting?
He's like, I don't need anything.
What are they suggesting I do? Yeah. I guess. I don't know. I feel like I'm,
Would you trust yourself to do a surgery on yourself?
I guess from that perspective, would I trust myself to do a surgery?
On yourself? Like if you had like if you had a clone.
I would hope so.
Yeah.
If I didn't trust myself, how could other people trust me?
Exactly.
Yeah. Facts.
Yeah. That's tough. Yeah. And how do you like get people to trust you for a surgery? Is there like ways that you feel like you can make someone more comfortable, or that you feel like is a way that you can connect to somebody? Because I feel like a lot of plastic surgery actually has to do with trust. Yeah. A lot of the time, like somebody could have a great, amazing before and afters, but if you walk into the consultation and they make you feel like you don't trust them, it's not gonna happen.
Yeah. And it comes down to just being brutally honest, like telling them what they can expect, the good, the bad. If they have unrealistic expectations, is to tell them, no, I don't think I can give you what you want. I think I can get 80% there, or simply, no, I can't give you what you want, and just don't do it. I'd rather you not do it than to try and do it, and I know you're not going to be happy. Yeah. And it's that just level of honesty and telling them the risks and the complications and the bad stuff that can come along with, that goes a long way in terms of building trust. And I think in a short time, if patients feel like you're really telling them the truth, the good and the bad, then you gain their trust.
Yeah, that's true.
Last question. So you had mentioned that your dad was also a plastic surgeon. Was there ever like competitiveness? Seeing as he's one, it's like, who do I go to? Right. Yeah. Or like people are like, oh, the dad's better.
Well, first of all, when I first started, he was like, a god in the plastic surgery community. I was like the little guy who was just starting.
Right. But you have an advantage in a way, because you're like, oh, okay, well, if he's a surgeon,
you get his like branding.
Yeah.
No, for sure, people trusted me to a certain extent because I was the son of.
Right. For sure that helped.
Which is so hilarious to think about, like as if plastic surgery skills were just genetic.
But so you're right. It's not, although maybe there is a little bit to it. But it's for sure. More, he took me under his wing. So you're under the tutelage. So there is a bit of that trust, knowing that you've been sort of taught by that person,
like mentored in a way.
But that only kind of lasts a couple of years. Then all of a sudden, like you're having your own results,
right?
And once you start to have your own results, you make your own reputation, and it took about probably 5 years for me to start getting out of his shadow. And until I opened my first clinic outside of his clinic, I left where he was.
Okay.
Opened my own.
Because you had started with him, and
I started with him for a few years, and then eventually I made a decision to open my own, and obviously things evolved quickly. So.
Yeah. And was he happy about that, or like, I'm trying to think.
Yeah. Well,
you're like, how long do you have?
This is a whole other family topic. If you really want to know, I could talk about. No, yeah, I think he was happy. He was proud.
Okay.
Yeah.
I mean, that you always want to see your kid go off into the same direction until they start doing better than you and you're like, relax.
No, that was never it. That was never it. He was never competitive with me or vice versa, ever.
Best quality price ratio for Botox?
There's such a huge range. I mean, you can find a good nurse injector at $10 a unit. You can have a plastic surgeon do it for $20 a unit.
Right.
They're both good as long as you trust the person and know what people who've had good
Yeah.
results. And yeah.
Also, wait, I have another, like a last question. What was it like doing your first surgery?
Yeah, I wanted to ask that.
As like your first on your own.
Well, you were shadowing with your dad,
Yeah,
right?
it's nerve-wracking for sure. You spend a lot of time planning before.
But does the patient know that it's your first surgery?
I don't remember.
Do you remember your first patient?
I don't remember. I I'm not sure that I told him, hey, you're my first
No,
patient.
I get that.
But anyway,
don't tell me.
But like, I want to know.
So there's a difference, right? Because yes, they're your first patient in solo practice, but it's not the first patient you ever operated on alone.
Right.
Not even close. Because where I trained at Georgetown in the US, you were left the last 2 years of my residency with tons of responsibility. You were left in the operating room alone, operating on patients after having gone through years of training. So you've already had tons of experience operating alone. So yeah, it's your first patient in your own practice, but I had already had tons of experience alone operating on patients by myself. So I don't think I told them, I've never operated on anybody. You're number one.
Right.
Hey
guys, this is my first surgery. Don't stress.
That's my first time.
But in your first year, for sure you're more anxious.
Yeah.
And that's where I leaned on my father.
Yeah.
And I would have him kind of there. And if it was a particularly difficult case, I'd say, hey, listen, do you mind coming in for your opinion just to lend a hand? And he would just be there. The first year, it's...
Yeah. Okay, like
it's a bit
actually, last question. Yeah. If you weren't a plastic surgeon, what would you be doing?
That is a good question. Probably something completely different.
Like what?
More on, let's say, the entrepreneurial side.
Okay.
Like I like people. I like the HR people side of the clinic too. You know, like I run a small business, so obviously most of my time is spent operating in my craft.
Yeah.
But I'm also involved on the small business side, and I find it exciting and fascinating. And so if I could not be a plastic surgeon, I would probably go in the other direction and be more like on the entrepreneurial side.
Okay, cool.
I like that.
Okay.
Well, thank you so much.
Thank you so much for coming on.
Super informative, and we really appreciate you coming on.
Thanks for having me.
And guys, if you're looking into getting anything and you're in the Montreal area, or if you're not, if you're anywhere and you want to fly for, see a good surgeon, what's your handle?
Jeez, that's a good question.
Yeah,
we'll link
you'd be more on the other side.
First of all, it definitely shows you how now my social media is basically managed by other people. I'm very much involved, but like,
we'll put it.
Yeah, I think you'll have to.
We'll link it down below.
It's Clinica or Dr. Schwarz. It's a combination of Clinica, Dr. Schwarz, I think. Okay. But I'm saying this. The reason I'm a little bit confused is because I also have another surgeon who joined me. She's on the South Shore.
Okay.
And I opened a second branch of Clinica for her on the South Shore. Okay. So I don't know if it's changed. There was some sort of combination done. So it's Clinica, Dr. Schwarz, Dr. Sauvageau.
I would be more nervous if he knew too much about the social media part of it. So it's not a bad thing. Don't worry.
So we'll link you down below. And again, we really appreciate you coming in, guys. As usual, don't forget to like, subscribe, comment down below, and we'll see you next week. Yay!
Thank you.
Amazing.
Thank you so much. It was perfect. Yep.